I think, sir, we are live. Hello to all the viewers joining us, myself and esteemed faculty of END, Dr. Dhawan, sir. So, we are here to guide you at this moment. So, this session is specifically for candidates preparing for the upcoming INI-CET and NEET PG, but most importantly, for candidates who are probably dejected after the announcement of the NEET PG results. So I think we'll start with that. So to all our dear children, it is just to let you know that in case if you are one who have not performed well in the NEET PG exam, dejected, distressed, feeling lost, this session is for you. And I've got Dhawan sir also joining me. Sir also will be sharing his inputs. But at the outset, this is something that I want to share with all of you. Now, I know that all of you at this moment of time, many of you might be feeling, sir, I am a failure. I am a failure. I tried, but I couldn't. For many students. But this is one message I want to tell you. This is just a screenshot of the name board outside my OP. As most of you know, I am a neurologist, and I want to tell you that any patient waiting outside for me doesn't know what my NEET PG rank is, NEET SS rank is, whether I am a topper or a rank holder. They do not know whether I've taken a repeat for UG or NEET PG or NEET SS. They do not know about it. So all that matters is the final destination. And I'm not just telling because, see, just to pacify you, this is the fact. This is the fact. All that matters is the final destination that you reach. In life, everyone makes mistakes. Life has ups and downs for everyone. You, me, Dhawan sir, everyone. But ultimately, what I want to tell you is, you will reach your destination. Your chance will come, and you have to wait patiently for that. Yes, you might have failed in this exam, but that doesn't mean that you will not be able to reach your goal. So I want to tell all of my dear children, do not be under too much pressure of your results. Even if your rank is bad, life always gives you a chance to correct. Life always gives you a chance to correct, and that is what at the outset we would like to tell all our dear students. Now, Dhawan sir, coming to you, students, many of them dejected. What will be your initial advice for all these students on how to handle this moment, how to handle this particular moment, sir?
Thank you very much, sir. The first thing which is coming to my mind right now, at this moment, students' mind turns totally like a stone. It does not absorb anything coming from anyone. And because it's a human, like reaction to a failure, that we just want to close our gates and close our doors and mental gates also. And maybe, introspect in a negative way that I wish I could have done that, or I wish I could have really done that with a course. But right now, the brain is not receptive to any advices, but I would suggest how to take this session would be to take, us as one of you guys who were passing the same kind of stage a couple of years back. Because I also repeated my NEET PG examination. The first time I could not crack the exam, and the second time my rank was below 500, and I took ENT by choice, not by compulsion. It means that, what Rahul sir is saying, that life gives another chance, definitely. And if you have to look for an example, I'm there. I think Sandeep also has repeated few examination. Everyone has got that. But yes, when you pass through that painful episode of your life, that chapter sounds the end of it actually. But it is just one chapter in your whole story. Do not worry. The next chapter you can make it a little brighter, or maybe very bright with the help of, guidance from, seniors, or, like look around, but do better right now. So the only message right now I would like to induct in your brain is, you are justified in the grief reaction, but it should be brief grief, and please bounce back faster. And this session is designed to make sure that you bounce back faster. Rahul sir.
Right. So I'll be taking very soon inputs from Sandeep sir also. Our pediatrics faculty sir has also joined. So I'll be coming to sir as well. So, see, for students who are listening to us, and some of you might have already decided, sir, I'm going to prepare for NEET PG 2026. Okay, so in that case, it is very important to learn lessons from the current exam. NEET PG 2025 highlights. Now, NEET PG 2025 had more previous year topics being asked, and there were many clinical questions. Easy to moderate was the overall difficulty level. Image-based questions 35 to 40 percentage, and lot of questions integrating multiple subjects. But let me tell you, as someone who has observed the national board pattern over last several years, never trust the pattern of national board based on a single exam. I would urge all my dear students to prepare for whatever difficulty level they may put before you, easy, moderate, or difficult. So when you prepare this time or next time for the next exam, I want you to be strong, not just in factual information, scenario based information, image based. It has to be, it's like whatever question they put before you, even if it is strongly PYT based or not, I would still urge that you will have to prepare for all sorts of questions, which means you have to have a good range. You have got to have a good range. That is what I would tell you upfront. Now, coming to the way forward, let me just give you two scenarios. Okay, this is what I want to stress to all dear students, and I want you to comment whether you belong to scenario 1 or scenario 2 in the chat box. Scenario 1, you recently finished internship and you hardly got a few months to prepare for the exam, and you have given the exam. NEET PG did not go your way. Now you will have to decide, okay, what is the next step forward. Scenario 2, you had already finished your internship, maybe 1 year or maybe even beyond that, but you prepared hard, but NEET PG results, you're totally devastated. That is scenario 2. Now, in case of students belonging to scenario 1, wherein you have not given a solid attempt, I think things are a lot clear, which means you have got to prepare for NEET PG 2026. Now, many students ask me, sir, what about November INI? What I would suggest is that let's put a mark at around 20,000 rank. If your rank is within 20,000, you've got a realistic chance probably of cracking the November INI. By which I'm not telling you that someone with a rank of 30,000 should not prepare for November INI, because see, this time there was a lot of clustering and even good students might have fallen in the range of 25 or 30,000. But I'm just telling you an arbitrary cutoff just for a general understanding. Because what happens is, even today I spoke to one student, Dr. Ganesh. I think he has secured a All India rank of 3844. So in first attempt, he got a rank of 1.5 lakhs. And he reminded me today that, sir, you remember I had asked you last time when I was starting my preparation, the INI was just a couple of months away. Sir, shall I prepare for INI? I told him, please be realistic. That should not be your goal. Because if you go for example, November INI, suppose your rank now is 1 lakh. Now, if you go for November INI, I don't think you have got enough time for a full solid preparation with one round of revision. No. In that case, if you go for some, very concise, lectures, I don't think that might help too much unless you have got a decent understanding of the subjects already. So for you, I feel NEET PG 2026 should be the aim, and you have to prepare for that either by offline class or online live or pre-recorded, whichever is comfortable for you. Yes, you will have to assess which is better for you. There are people who go for pre-recorded, people who want offline, people who want online live. Listen, everyone is different and you will have to make your own choice. So this is upfront for the students of scenario 1, okay, preparing for NEET PG 2026. Now coming to scenario 2, this is the tough part. You have given everything, but again, you have missed the mark. Now, I'm sure that at this moment, as Dhawan sir said, many of you might be in grief. But once you take a couple of days off, you will have to retrospectively analyze what went wrong. That is very, very important because see, even I met a student today also. Like he told me, sir, I gave everything, but I couldn't get a good rank. I am confused on what to do now. It is very important to understand what went wrong. It might have been like you did not watch the main videos, you only watched the revision videos, or it could be like you didn't do enough MCQs, or it may be because you did not give enough grand test, or it may be that you did not revise properly. Reasons can be many, but you have to write in a book yourself on what you probably wrong, because you will have to make necessary corrections before you decide the next step. That is what I want to tell you. Now, in your case, again, I would tell you, sometimes certain failures come as a blessing in disguise. Suppose your rank is around, say, 12,000. You wanted general medicine, but your rank is around 12,000 or 16,000. Now, suppose if you give that extra effort for the next couple of months and give November INI and make November INI yours. Suppose you get a single digit rank for November INI. Don't you think you can change your fortune? It is possible. But if you feel dejected and if you start doubting yourself, that is when things become difficult. If you have got a decent understanding, decent preparation, November INI is a realistic possibility. Remember what I told you, the final destination alone matters. So that is what I want to, tell all of you, partly regarding this. A few more points I would like to add, but
Sir has given you a very good, way where you stand, what place you belong to, and what should be you should be planning. Coming to, if you are targeting INI-CET, irrespective of your score, if you have done all the 19 subjects once, see, you need to understand that this exam was on the easier side, if prima facie, if you see, but at the same time, the options were very close. And the deciding questions, even if your score is, say, 10 or 15 questions here and there, it went, you would end up with a score, instead of being in the top 10,000, you would end up with a score with a rank of somewhere around 30,000, 40,000, or 50,000. So getting that 50,000 doesn't mean that your preparation has gone waste. So I would strongly recommend that if you feel and if you are within the top 50 or 60,000 and you have read all 19 subjects once, every reading, if done properly, every revision, if done properly, adds 10 to 15% to your score if done properly. The question is how passionate you are and how focused you are. Second thing, if you are targeting INI-CET, why it is a better gameplay for a somebody who feels that he has prepared well and not done well this time. INI-CET is a more vertically oriented exam. What NEET PG does is something from every system and a few bouncers they will put in. So it is very difficult to revise in a short span of time. In INI-CET, the predictability rate is on the higher side. Yes, exams are unpredictable every year. Some subject will always have more weightage compared to others. But if you look at, I'll take my own example subject, pediatrics. INI-CET, you can almost predict that there will be one question from nutritional index or malnutrition, one question from short stature, one from milestone. If milestone does not get asked, weightage extra shifts to newborns. Newborn minimum 2, maximum 4. One will be respiratory distress, one will be jaundice, one will be your lysosomal storage disease. Sometimes it is two lysosomal storage diseases and so on, and one vaccine. Now, if you look at it from a bird's eye view, you will find that out of those 9 or 10 questions coming in pediatrics, 7 are predictable. If you are thorough with the recent INI-CET papers, and you build upon your deficiencies in the NEET PG exam and smart focused revision you do, you have a very, very good fighting chance in the competitive exam. There is a guy, I'll name him now because he has finished his MD. Otherwise, I don't personally believe in taking names. Rajat Patodia is the name of the person, right? He's a real person. Rajat Patodia was the person who got somewhere around 16 or 17,000 rank in NEET PG. That was in 2022. And 6 months later, he was within the top 150. Yes, we were in touch for quite a few years. Then, people tend to lose each other. Last I heard, he was, planning to appear in super specialty. Why the name has stuck with me? Every birthday of mine, every New Year of mine, and every Teacher's Day, he messages me, and that is the time we catch up. But the name has stuck around. Why am I giving this example? If someone with 16,000, 18,000 rank can jump into top 100, why cannot you do the same? Top 100 doesn't mean top 100. Right now, in 2022, if you compare with now, INI-CET, more aims have opened up. And even if you get into the top 500 or 600, you will get a branch of your choice. See, you will not get MD medicine or MD radio diagnosis or MS ortho in AIMS Delhi or PGH Chandigarh, but you will definitely get a branch of your choice. End of the day, you are doing a branch of your choice. You are doing it from a central institute. No bond is there. Just 4 months. And trust me, all this cycle of counseling, joining the medical college, that is going to take time. So it may be possible that people who have done well, better than you, and you are probably joining around the same time with a gap of about 2 months,
Absolutely.
and you are in a better position financially and bond wise. The
Correct.
game is in your court. The only question is, are you willing to work upon that? The only catch is, if things have not worked out this time, should you stick to the same thing or should you change things a bit? Over to Rahul sir and Rajiv sir for more elaboration on this. Sir, should we change it or should we do something about it?
So I think it all depends on how you feel about your current content, because I'm just having a question from Dr. Anand Mishra. What about case scenario 2, but rank is beyond 80K? That is tried, but his rank is beyond 80,000. Now, just like Sandeep sir has said about the content, if you feel your content is weak, then that means you can think of probably a source change if your content is weak. But if your content is strong, you've made good notes, in that case, I think it's about practicing more MCQs and giving more grand tests rather than changing the source altogether. But one thing I want to tell you, I think just a continuation of, I think, 2 points Sandeep sir said. This time, last time when students used to ask me, sir, I've not got NEET PG, I used to say about this 20,000. But this time, since the exam was easy to moderate, there is not much difference between a candidate who has got a rank of, say, 20,000 and 40,000. I'm sure that there is a lot of clustering. Now, it is for you to decide on how good a student you are. And you've got to take that decision. You have got to get that gut feeling. Is it possible for me? If the content is good and you have done some good revisions as well, and maybe, the exam day did not go well for you, make November INI an opportunity. Forget about the failure, and here comes the opportunity, that is November INI. But at the same time, if you feel that, no, I am having 1.5 lakh, 1 lakh, I don't think my content is, you please go for NEET PG 2026 is what I would strongly recommend. Now, in continuation with what Sandeep sir said, when you plan for INI-CET, you have to understand the game before you play it. That is very important. INI-CET, as Sandeep sir said, is more predictable than NEET PG. So the predictability quotient is more. Slightly more emphasis on first and second prof subjects doesn't mean that the final prof subjects are not represented, but there is a tilt towards first and second prof subjects. PYTs are very, very important. Now, if you are someone listening to us and you have made a decision, sir, I think I can make it for November INI. What I would suggest for you is, whatever notes you have got, you revise the notes thoroughly, and maybe you can top up with the revision videos. Now, if you are following the DocTutorials QRP videos, I'll just show you a couple of screenshots on how we have done it. I've just put some screenshots of medicine. This is cardiology. Now, cardiology is a big system. Now, if you feel that, sir, I am weak in cardio, if you go to this QRP section, you can see every topic, every representative topic, I've put it in short videos, maybe a video of 1 hour or 1.5 hours in the app, or 45 minutes. They are all 5-minute, 10-minute video. You can see pulse 15 minutes, hypertension 15 minutes, JVP 10 minutes, heart sounds 8 minutes, murmurs. It's a very confusing topic for many. I've summarized in 9 minutes. ECG basics in 6 minutes, interpretation in 2 videos, each of 16 minutes. So something which is elaborate in the app is concised into the QRP. Even if you look at ENT QRP, I was talking to a ranker, and that ranker relied upon the QRP, and he said he got 100% strike rate just by watching QRP videos. That doesn't mean that our videos are you just watch the QRP. The reason why I'm telling you is in DocTutorials the QRP videos are optimal, neither too short nor too long. I'm sure I'll come back to Dhawan sir for just a representation of the QRP section. Sir, what was there in your mind when you actually framed the QRP program?
Yes, sir. Before I go to that question, I would like to, see the same thing from a different angle right now. Please do not look at the rank, what you got in this exam, as a self-assessment, actually. Look at the number of questions you got correct, because clustering would make you confused, as Rahul rightly pointed out. Let us not go to the rank side where you stand.
Yeah.
Let us look at the number of questions which you got correct out of 200. And as compared to the rankers, how much they got. You have the idea over there. Secondly, everybody has got a self, evaluation tool in the brain. We all know which subject we have done properly, which subject we ignored completely, and which subject we are only moderately okay. So rather than, sort of feeling just slow or sad about
sometimes,
it,
the rank like a 1 lakh.
Yeah. It looks like horrible.
It's a horrible rank, but actually not much difference between 1 lakh and 50,000, sir. That is.
Yeah. So I was evaluating the whole day, the number of, question you got correct versus the rank. The rank looks horrible, guys. And Sandeep sir is giving you a genuine hope by sharing a story of a guy. Why so? The reason is that sometimes rank give you a very dark feeling about your preparation. My take would be, let us look at the number of rights we got. Okay. Let us look at our own assessment about our own preparation and take the decision accordingly. How much time we have for INI? Maximum 3 months. You may be thinking, oh my God, it's like another exam now. Just see, we are at the tail end of August, more or less. September, October, and November is the exam. How much? Less than 3 months, close to that. And if these 3 months can be utilized to put right kind of icing on the cake, the life can change in a very different direction. You can see that. And none of us is here to create the flowery picture that everyone will do that. But chances of everyone doing that are equal right now. Whether it happens or not, it is your take, definitely. Now I'll come to the QRP. The QRP, we are not propagating this or that. You know what? We always put ourselves in the shoes of the student, and then we design the content in DT team as 19 faculty team. Now, when I did, or Rahul, so I think me and Rahul had a discussion around, bringing some crisp, short, like medicine content. I think, he has done a phenomenal job over there. Similarly, Sandeep sir has done wonderful job, and everyone, I would say. For ENT, I can tell you my feeling. My idea was, it's a game of 19 subjects and 200 questions. This time around, 11 to 12 questions out of ENT, there was 10 questions out there. Okay. Now, the thing is, we need to allocate the time as per the relevance of the subject. Sometimes we see like 40 hours videos for subject like ophthalmology, ENT only, and 40-hour video will have notes also of that much width only. Now, you don't get to either revise at all, or maybe you have a quick reading of one more time of those notes, main points. The problem is the first time effort of watching those 40 hours goes waste. So what we did in this QRP was to bring the conceptual gist of the subject in front of you, give it a clinical, story format wherever like it is required to, add on the recent advances also, so that you get the rank deciding cutting edge question as well, because idea is not to only crack the exam, idea is to crack a good rank also. So if you happen to see the QRP of various subjects, it would, number one, make you revise whatever maybe you previously know. Definitely give you the cutting edge, the rank deciding question top up on information also. And the difference is only very less sometimes. For a person who scored 20,000 rank, for him to score INI, maybe below 100 rank, he has to do this much more. And there lies the importance of the right content over there. Rahul sir?
Yeah. So that is what, I was trying to tell you. If you are realistically targeting November INI, the QRP videos of DocTutorials will definitely help you immensely. Now, suppose, you're not planning for November INI, then you have to focus for NEET PG. If you realistically feel, after all what we have discussed, if you feel, no, sir, I don't think that November INI is what my target should be, then your focus should be crystal clear on the upcoming NEET PG. Don't confuse yourself on the next couple of months. I've seen students rank maybe 1.5, 2 lakhs, just thinking, sir, can I just study for INI? And look, if you're that much determined and focused and you believe you can do it, yes, you can. But otherwise, take it easy, go for NEET PG. And the first thing I want to tell you, probably the most important, do not wait for an official date declaration to start NEET PG. Because many students have asked me, sir, can I go for a part-time job? And once, the NEET PG results are, or NEET PG dates are announced, I can come back. I'll tell you, I'm taking classes for the super specialty as well. So is Sandeep, sir. Look, National Board of Examination, sometimes I've felt, they come up with sudden announcement. For example, NEET super specialty, all of a sudden, all my dear students were expecting the exam would have been in Jan, Feb, March, something like that. We were discussing, not even in the wildest of dreams to students think that the exam would happen on November. And yes, the exam this time is happening on November. Since the current NEET PG is a postponed and a significantly postponed NEET PG, you may not get one full year of preparation. So do not wait for a date declaration. And if I was in your place, in my mind, in the timetable that I have in, I'll probably start with the worst possible date, which I'll put as March. I'm not saying the exam will happen in March, but for me, the earliest possible date is March. And I'll think like that. Okay. So which means somehow I've got a target in my mind. I'll somehow try to finish in Jan with one round of revision in Feb. Okay. Again, I'm telling you, I'm not telling you that the exam is going to happen in March, but that is a worst scenario. Now, the
Sir,
advantage
sharing the dates with you, students who are listening to it, Rahul sir is saying a very, very important thing. This year, NEET SS was held on 29th of March. Everyone was expecting it will happen next year in March only. Now, NEET SS second exam is going to be held in the month of November, 7th November. Why? Because examiners felt that we should, reset the cycle. National Board of Examination, same board which decides your NEET PG dates, has decided to do it in SS. And it has come as a shocker because people who did not do well in NEET SS, they were like, okay, 1 year to go, join a job, earn some money. Don't fall for that trap. Sorry, sir. Over to you. Just the dates came to me.
correct. So that means, you hardly had half a year, for preparing for the next cycle of NEET SS. So now regarding NEET PG, I would always tell unpredictable, don't take a chance. Because if you are someone who is beginning the preparation, looking at NEET PG 2025, oh good, the topics are all very familiar. Though I did not do well, it seems pretty much doable. It might superficially look like that, but I would say never take a chance. Have a good range, whatever be the type of exam that comes up for 2026, easy, moderate, difficult, prepare for all ranges. You should have that range. And when you attend good quality lectures, either face to face or online live or pre-recorded, that is about building the content. So do not be under the impression that you will just solely rely on revision videos alone. If you're preparing for NEET PG 2026, you have to go for your main videos itself, is what I would tell you. Now, PYTs are important, but if you have noticed, I have put an important here, and for INI-CET, very important, which means NEET PG also, yes, previous year topics are asked, but especially this time, we had good representation, more than expected for NEET PG, so it is still important. So for those preparing for NEET PG, main videos, QBank, GT, and I would say 3 rounds of revision. 3 rounds of revision is ideal. But again, it depends on what the exam date is. But again, this slide, something that I've highlighted, do not wait for date declaration. And, it's better that you continue your preparation rather than maybe you can take a day off or a week off, but not more than that, I would feel, because then if you're totally out of momentum, then it might be difficult for you, is what I feel. Now, you can stay in touch with my Instagram academic page as well, in case you have got any queries and you're watching this session later. And this is the WhatsApp group, and you can join here for the discussions for medicine, in case you want to have an active discussion as well. Now, coming to how DocTutorials can help. Look, for the preparation, because many students have asked me, sir, what content? I feel I'm lacking in content. For those students who feel that they want a content change, I repeat, if you're someone who has prepared very well, your content is strong, it's just that the exam did not go your way, November INI is your target, and then I think you would stick to the same resource. But at the same time, exam series like the RDX series, which is something that everyone is looking forward to. And I think, Dhawan sir is the right person to talk about it, because he's the person who coined the name as well, the RDX series. So Dhawan sir, I think just quickly, that point also we'll add before moving to the next, a few points that I want to discuss. Sir, RDX series for INI-CET. Many students have told me that it actually helps in planning, the last month for preparation as well. So how do you see the RDX series for the INI-CET that is going to come up?
Yes, sir. Guys, what happens with the basic content reading and maybe the shortcut to the subject? Everyone start getting the PYTs in their arena, but there are always some rank deciding questions which I've been seeing since beginning, that they actually make the difference. Now, the problem is when you just superficially see the content and you just see the main topics have been asked, and you get a pseudo feeling that I'm doing well. I'm really doing well actually. But when the real exam happens, how many questions actually decide the rank? You must have seen this time also. There was a list actually how many questions got correct versus how much rank. 10 questions, differently done, change the life actually. That is what is a rank deciding question series. And in that we give a schedule over there. It's like every subject's expert would come and discuss those 20 questions and the relevant concepts. Those 20 questions are just the beginning of discussion for those particular topics which can be rank deciding topic for you. And that is what the rank, and that is the one activity we do. We do a lot of activities. Rahul sir, I would like to just share one thing with you, through you guys also to the students. Guys, there's a complete ecosystem you need to utilize to reach the pinnacle. What happens is just doing the some shortcut videos, some YouTube revision videos would not help you. At least you have to be conceptually clear about the majority of the things of that subject. Yes, a smart study is needed. Our DNA in DocTutorials is what we know how to make subject conceptual, comprehensive, but yet concise. May I say it again? It should be conceptual, still comprehensive, but yet the story should be said in less number of words. Why? Because for the student, it should be possible to revise, as Rahul said, 3 times. And the 4th revision is also mandatory just before the examination. Otherwise, what happens? You start forgetting the factual data over there. So guys, please look at this. For example, the online live classes of DT. I'm just giving example. Some student is there. Then on top of that, if you do after the 2nd revision, you do the quick revision videos. After that, you do the series like HIT series or the RDX series. That becomes the complete pyramid over there. And that is the path which takes to the pinnacle in the exam result also. Rahul Rajeev, sir.
Right. So coming to the DocTutorials, the resources. So as of now, students looking out for solid content, I've got 3 options for you. Number 1 is the pre-recorded lectures in the DocTutorials app. Number 2, I think, which has got a lot of attention by the students, especially on the workbooks that we have made, the questions that have come related to those topics, the concise nature of the lectures, is the DocTutorials Online Live. And I'll tell you, independently as than a DocTutorials faculty, this is one of the ACE programs of DocTutorials, wherein all the 19 subjects will be taken by subject experts in online live format. And most of the classes will be towards evening. So if at all, there is an intern who is listening to me, it is comfortable for you as well. Hard copy colored workbooks will be couriered to you and you can watch the lectures. There will be a timetable which brings in the element of discipline. Unlike a pre-recorded lecture where you will have to design your timetable, here we design the timetable for you and we only request you to stick to that schedule, watch the live lectures live itself, because then you will be able to finish according to the schedule and which will give you enough time for revision as well. And in DocTutorials, there will always be a mentorship. And if you have listened to the videos in the DocTutorials YouTube channel, I think every faculty in DocTutorials is always approachable to you. We have got dedicated WhatsApp groups for face-to-face classes, online live batch students, wherein any query asked will be promptly responded to. And this is one course that you can rely upon, the online live. You also get access to the QRP videos, the Q bank, the test series, all are being updated constantly as well as per the latest pattern. So online live is something that you can look, especially for candidates who are looking out for a solid content. And we also have got offline centers, 3 offline centers at DocTutorials Hyderabad, Calicut and at Trivandrum, and we have been extremely happy to see our face-to-face students as well doing extremely well, because if you want some discipline, you are welcome to Hyderabad, Calicut or Trivandrum to the face-to-face centers, because therein, the same faculties, Dhawan sir, Sandeep sir, myself and all the faculties will be coming face-to-face and discussing the content as well. So if you're looking for content upgradation, this is something that you can do. So any point to be added, sir?
Sir, one thing I want to emphasize.
Yeah, sure,
like
sir.
what will happen is some of the students are of the opinion ki, sir, I'm sitting at home, I have an app, recorded lectures. Ask yourself honestly, do you have that discipline that you can finish the entire pediatrics with MCQs, with PYQs in 3 days or so? Even if you have an app with you, trust me, you cannot. That is human nature. You don't have the discipline. 10% of us have, 90% of us don't. Even at least I don't have if I'm a student today. I never had it earlier. I don't have it today. Rajiv sir is waving the hand. Sir doesn't have. Rahul sir has. Rahul sir is different. I'm telling you very clearly, right? I don't have. Rajiv sir
I'm
don't.
glad we represent that group actually. Yeah,
Yes.
because
So
every
the
student
thing is,
different. Rahul sir would have done it.
yes, Rahul sir would have done that because Rahul sir is very to the point, very clear, getting up on time. We Sandeep, myself, Dr. Sandeep and Dr. Rajiv Dhawan, we both are a bit low. So you can see the discrepancy here as well. So if you have the discipline and you have an app and you feel you can work upon that, continue with it. But if you feel you belong to those people where discipline is lacking, you start with something, you finish 70% in 1 week, and then you are like, oh, I'm tired, bored of this subject, let's go to another. This is the problem. Because if you are not touching that 30% and questions get asked, every question matters, and then it leads to a pile up of untouched areas, untouched topics, and then it hurts you in the exam. When you join this online live pack, then you will be told that from this date till this date, I'll give an example. From 24th till 27th will be pediatrics class. I will be coming at 5 o'clock and I will continue till 11. So 5 to 11, you are working, you are sitting at home or an intern or preparing, you will be forced to watch this video. Suppose you miss out something, recording will be available to you. Tomorrow morning, you can finish it off and join from the day 2. In 4 days, your syllabus will be over. Now, suppose you feel ki, sir, I want more details of the topic. That topic, detailed recorded V5 video is available to you. So you want more details? Open up. I told RDS topic in half an hour to you. You say, sir, I want more details. So RDS is 45 minutes in the video. RDS means respiratory distress and the related disorders. So you can read the detailed video recorded version. Because you are attending the class, it brings discipline. Close to the exam, once you start watching QRP, I am the same person who has recorded these videos. You have attended my live class. I will summarize it for you, entire pediatrics in 12 hours. It will match with your existing notes. It will match with your Q bank. Finish 2 or 3 times my syllabus. If you can, great. But if you cannot, join a live class which gives you the discipline. And if you want more, if you want to see recorded, that option is available to you. So this decision has to be decided by you.
And I think, many toppers also, if you see of late, they have used all these DT online live. I remember Vishal was one student, INI-CET rank 16. Every lecture in the DocTutorials Online live he has watched. Even currently, many toppers of the DocTutorials Online live. I think even Dhawan sir was interviewing a student of DT Online live. So these students have all used the DT Online live, which is almost a simulation of the face-to-face classes. So this is what you can do. So I have just briefed you on what you can probably do, and we have given you the probable scenarios as well. And make use of the resources that you have got, and you take a decision. Am I going for INI-CET or am I going for NEET PG? But I think there is something I want to tell you as a senior. It's like I can see a comment in the somebody wanted medicine, but the rank is not there. What to do? See, taking a branch is a decision for life. It's not a course of 2 years or 3 years and you stop. No, it's not like that. It is a decision for life. And if you are so passionate about a branch, so passionate, you have to give yourself another chance. But if you've got other options and this is not a passion, then you can consider other options as well. But that is what I want to tell you. Never, because then you will repent later. I could have given one more chance. Because see, just because you failed doesn't mean that you are a loser. It's probably that you've got one more test to go. That is it. So that is what I want to tell you on compromising. If you've got 2-3 branches, you're comfortable with any of them, then maybe you can make choices. But if you're so passionate about it, never let it go. That's what I think. Sandeep sir?
Absolutely, sir. Absolutely. See, I am passionate about pediatrics, and I'm willing to take that risk that tomorrow my rank may slip. Go for it. Take 2, 3, 4 attempts. It's okay because you have passion. Shock, shock, the Hindi word, not the English word. Shock and passion. Usme the wisdom does not always work, right? But when it comes to your flexibility, suppose you want a surgical branch, your option of choice was MS Ortho, but you are getting MS General Surgery and you are okay with ENT also. You like Rajiv sir, and you feel that, I'm okay with the MS ENT or MS Ophthalmology also. Go for it, because end of the day it's a risk. You never know whether you will get a chance again or not. Again, same true for MD versus DNB. If you are getting, there will be an exit exam, but if you are good, if you are passionate about it, people crack in the first attempt, and DNB pass rates have improved. But at the same time, if you're clear, I have to do MD only or MS only, and I have to do in a particular branch, and you're not getting, give INI-CET a good shot. Let it be your revision. Give one proper reading, sit in the exam. Who knows? You crack. Even if, see, worst case scenario, you don't get anything. Do you have anything in your hand right now? None. All you end up is getting a seat of your choice. Best case scenario, you get a seat of your choice through INI-CET. Intermediate scenario, your score improves, you get into the top 10,000, big, big booster. The next NEET PG or INI in 26, you will get through. So
Correct.
you just need to think back, because this is a decision nobody else can take for you. You have to take this decision yourself. Your parents cannot take, your siblings cannot take, friends cannot take, you and me cannot take, Rajiv sir and me cannot take. Only you can take.
So for all our dear students, if you have not done well this time in NEET PG, I'm sure many of you might be having your heads down, but God will give you an opportunity to come back, to have a smile for yourself, your parents, your teachers, and we'll be looking forward to having an interview with you as well to hear your comeback story, because that can be an inspiration to many, many other aspirants as well. So it's up to you to decide, how you want to take this. You can be a champion, you can come back stronger. Wish you good luck on behalf of entire DocTutorials family. Good luck, everyone. Thank you so much.
Thank you, everyone. Again, just keep in mind one thing, that this is the most crucial juncture of a doctor's life, because up till now, we all are MBBS, but after this, there are 19 branches and so many medical college options. I think job or no, you should not be doing the job actually, because if you do the half-hearted efforts, again, we land up in the same situation. And please do not trust NB for anything. You know it. In the language of medicine, it's irregularly irregular. This time exam was little bit more predictable. Next time will be more dynamic examination. We have to be thorough. You understand. But our take is the thoroughness can be concise. The online life things and all can make your life easier. Your fears can become your strength areas. Once you hear those faculties teaching the subject in the way they know the subject, it makes a lot of difference over there. Sandeep rightly pointed out that if liberty is given to us for watching, videos, it's not Netflix, you would definitely, we can see from the back end, after how many minutes you drop that video, or you drop that segment and you open up a new segment actually. So guys, rather than just feeling low, we all understand that you are feeling low. It's a method to introspect and really do the corrective efforts as per the current level of preparation you have. If you need to look for alternate resources, we are there to help you in a very systematic manner, and we are a very passionate team over there. And we have got the complete armamentarium to support your journey towards your wonderful rank. So let us put a joint, foot forward together to make sure that you get what you are aspiring for. So good luck from everyone's side, and we'll keep meeting again like this in the future as well.
Thank you so much, everyone. Thank you. Thank you.
Thank you. Thank you.